Boston Medical Center has been at the forefront of providing highly coordinated team-based care, applying principles and practices in their pediatric comprehensive care program that are now being integrated throughout the healthcare environment.
Our program serves in many respects one that reflects the larger population that our hospital serves. That is, we are situated and are positioned to serve the most high-risk and underserved populations in Boston and the surrounding areas. From a medical standpoint, those may be kids who are graduates of their neonatal ICU. These may be kids who have syndromes or congenital birth problems. These may be kids who have neurodevelopmental disabilities or some combinations of those things.
Most of our patients come from the NICU, so that these children have had a really difficult birth. And if you can imagine what the parents are going through when they have this difficult birth of this very sick baby. So once the baby is stabilized, they're usually sent to our program, and we become the primary care providers for them.
Many of those children live in family systems that are compromised or distracted or are stressed by things like complications of poverty, toxic stress, and family chaos. There may be electronic medical records that don't talk to each other. There may be hospitalists or specialists at different hospitals who communicate infrequently, if at all. There may be parents who have language and cultural issues which really impair their ability to understand and then sometimes communicate back.
We provide the continuity of the same providers, the same nurse, the same social worker or family navigator, so it can really be a second home away from their home.
We have a multidisciplinary team working in a horizontal fashion to help defragment, to help make sense of, and to really break down the many, many tasks and challenges of caring for these kids in a manner that supports the family and really helps advance their goals, while keeping the child and family at the center of the picture.
David is one of the over 500 patients currently enrolled in the program, and has been a patient since graduating from the NICU 5 years ago.
You know, the journey with David has been one with many twists and turns in the road. I think one of the big ones early on was, will he see and will he interact with the members of his family? He had some issues with being able to focus and fix on people and objects. Now, he got some glasses following some eye evaluations, and it transformed his ability to interact with family members. And a child who was often maybe locked out or less interactive, we were all able to share in his smile and the way he would respond and giggle and crack up and then soon have a room cracking up, just because he has such a winning and charismatic personality.
The key to achieving a high degree of coordination is the family navigator, the care team member who helps patients and families overcome access barriers and coordinates care among multiple agencies and specialties.
Every day, things like limitations or constraints on housing, food, power, employment, money will completely affect and shape our ability to make progress with our parents in moving forward in terms of care plans and making recommendations for them, let alone having their attention and their ability to really absorb what we're talking about.
We really want to make sure that the parents are set up with great support in the neighborhood and in the community so that the family can thrive and the child can thrive.
So what I do is I help our families find different types of services and resources in the area. So that can range in anything from DDS, so the Department of Developmental Services, locating funds through Social Security income for the children, finding after-school programs, before-school programs, in-home therapies, those kinds of things. We kind of just try to support the family as best as we can in providing those services either in-home, in school, or in an institution.
Is this the Greenwood School? Great. I'm just calling regarding the after-school program that you have over there. Is there a way
I love the work that we're talking about. And I think one of the things that motivates me the most is the opportunity to work with the team I'm blessed to have. So even though there may be hard days and there can be days where you have your head in your hands, when you get one or two of these win-backs, seeing a child walk, seeing a long fight for a wheelchair go through, seeing a service delivered that had been fought for against some obstacles, that's a really good feeling.